I want to thank you so much for being in the Congress. Welcome back to Mexico. So we want to talk a little bit about the ACEs. Can you talk and describe it briefly?
What the ACEs are?
Yes.
Okay, adverse childhood experiences. And they were a model that was adopted in a hospital in the United States back in the 80s, I think, when a practitioner recognized that there were a group of patients who consistently couldn't stick with the program, whether it was for obesity or alcohol addiction. There was a small group of people who continuously dropped out of the prevention program that they'd been put on. Okay. And so this hospital decided to start taking more notice of these patients' life histories. And from that life history, they recognized that there were a number of factors that were similar for all these people that couldn't stick to a preventative program. And they came up with these adverse childhood experiences. I think there are 12 of them, 12 indicators. And they are things like whether or not you've experienced violence in the home as a child, whether or not there has been alcohol and drug addiction, whether somebody in the family has been incarcerated, a series of things which indicate that the trauma you will have experienced as a child will have an adverse effect on you as an adult, your brain development, your physical health and your emotional health.
So how are you using the ACEs in UK?
Well, you'll be interested to know that you've been using them in Mexico, well, certainly in Juconi, for a lot longer than we have in the UK.
Wow.
Because while we have lots of really good mental health services, and we have lots of great physical health services and social care, we haven't really joined them together effectively. And although our social workers who work directly with the families have some training in emotional health and some understanding of the fact that what happens to you as a very young child will affect your behaviour and your outcomes in later life, we haven't used this in a very systematic way in the UK until recently. And in the last few years, the whole adverse childhood experience approach has really taken off in the UK, and people are very interested in it. And that's because there's been a much bigger conversation across the whole population about mental health. Right. A much greater recognition that our good mental health is really a prerequisite for our good everything health. So everybody wants us to be mentally healthier as well, and that we have some very scary indicators about poor mental health, particularly amongst children. Right. So in the last few years, we've become really interested in adverse childhood experiences and trauma-informed systems. And so the way it's now being used is differently in different areas. We don't have a whole government approach to it, but because the government in the UK is split between 4 different countries, some parts of the UK are using it much more systemically. Right. In Scotland, for example, they are now rolling out a whole trauma-informed approach using an ACEs model, an early adverse childhood experience model, throughout their system. Wow. Police, health, social care, education. Wow. But Scotland's quite a small country.
Right.
In other parts, so what we're doing in Lambeth, which is one municipality within London, we are looking at a trauma-informed approach for all the children's services that go across Lambeth. So that's working with police, health, doctors, health visitors, midwives, so that they're all understanding that, working with parents too, because we have very young parents, teenage parents often in that part of London, who may themselves have experienced adverse childhood experiences, that the way the service interacts with those young parents may actually make them feel worse. So the idea is to make sure that the service doesn't trigger something that somebody will have experienced in their early childhood. Okay, so that's one way it's being used. And the other way is understanding that, particularly with children, that their behaviour that we may find challenging and difficult and impossible to manage comes from their experience and is their way of communicating. It's not necessarily that they're bad. Right. Well, it's not that they're bad. It's that their experience has given them a set of behaviours which has helped them to survive.
Right, right.
And when practitioners understand that, it really helps them develop their empathy with the young person, right. or the young adult themselves too.
Right, right, right. So speaking about the ACEs, is it a questionnaire?
Yes, and at its worst, it's a questionnaire, okay? Mm-hmm. So one of the problems with the way that it's happened so fast in the UK, for example, lots of commissioners, because it's become a kind of trend, mm-hmm. they want you to use an ACEs approach. Okay. So people are now downloading the ACEs questionnaire, and then they may sit with a child and say, have you been abused? Did your mother or father, like that.
Right.
And that's the wrong way of using it. So
right.
that's in the worst cases, but mm-hmm. that is the complication, is that if it's just used as a questionnaire, it's not a good approach. It has to be used to sensitize the practitioner, but not as a questionnaire.
Okay. I really want to thank you for being part of the Congress and giving all these great feedback about the ACEs. And thank you so much for attending. And thank you so much for the interview.
Thank you to Juconi for organizing this amazing conference.
Thank you, Erin.